It's been just over 6 months since the pandemic was announced back in March the 11th, 2020 by the World Health Organization. And since then, everybody's world has been turned upside down. However, Onguanara, thanks to everybody's efforts, I think has managed its way through this, the pandemic thus far, extremely well. But throughout this experience, all of our routines have been disrupted, and there's been a great deal of uncertainty that's been created by the pandemic, and that's been difficult for everyone. And no doubt throughout the course of this pandemic, everybody's experienced a range of emotions, and they have maybe ranged from fear and anxiety to anger and depression. And you're not alone. We've all experienced these emotions to a greater or lesser degree. And how we cope with these emotions really is very individualized. And that's based on our life experience, based on our current circumstances, or based on protective factors that we may bring into play. And it's important, however, that we all acknowledge these feelings and understand that each of us has days where we just won't be our best self. And that's okay. And it's with this in mind that Onguanara has joined CAMH, or the Centre for Addiction and Mental Health's Not Myself Today program. And this program provides us with an entire toolbox of resources that can help us create a mentally healthy workplace. Not Myself Today is an evidence-based and practical solution with 3 main outcomes. 1 is to build greater awareness and understanding of mental health among our workforce. 2 is to reduce the stigma associated with mental health. And 3 is to foster a safe and supportive work culture. And now cast your mind back to February the 11th, 2020, which was the first town hall that I did after having been appointed as CEO. And at that point, I referenced our values of support, respect, and choices. And at that time, I indicated that we should absolutely be supporting, respecting, and giving choice to the folks that we support, the individuals who look to us for service. But we should also be supporting and respecting our colleagues. And this is where Not Myself Today comes in. We have to support each other through this time, and we have to respect the fact that each of us will respond to these circumstances differently. One thing that you'll notice on my lapel, I guess, here is a button that says Not Myself Today. And that's shown my support for this program. Moving on to where we're at in terms of the pandemic, the current phase that we're in with the pandemic really is probably the most challenging yet. We've moved away from the lockdown restrictions, and we're moving towards what I guess we would characterize as a new normal. We've started to reopen our day programs in a limited fashion, our pool, our children's respite program, and some office staff are returning to the ORC. Additionally, restrictions on family visits and short leave absences for the people that we support have been relaxed for individuals living in our congregate care areas. We realise that the loosening of these restrictions creates some anxiety amongst staff with regards to what activities are safe to do, what's not safe to do, for the people that we're supporting, etc., etc., etc. We continue to follow public health recommendations, and we adhere to the guidelines set out by our ministry regarding the reopening and resumption of services. And we have to do that for the health and for the safety of everyone. The people that we support have been impacted every bit as significantly by this pandemic as our staff has. Their routines have been disrupted, they've been separated from their family, and they too are anxious for a return to normal. And it's our role to support these individuals by helping them cope with the situation, by educating them about good hand hygiene and risk reduction habits related to COVID-19, but also do so in an environment that respects the right to make their choices. Again, support, respect, and choices. Whether this is the number of cases in KFLA is starting to tick up slightly. The number of cases provincially is ticking up quite significantly. We don't know if this means a second wave of COVID-19 or not. But it's really, the uptick is not surprising, because over the summer months, things were relaxed, things were opened up, people could go to bars, they could go to restaurants, they could engage in more social activities. And that fact makes it even more important that we are even more diligent when it comes to exercising good infection control practices. We need to continue to be diligent in our protection of the people that we support, our families, and each other. We need to follow good infection control practices, wear a mask, frequent hand hygiene, physical distancing. We need to make sure that we make good decisions when it comes to, if you like, self-management regarding risks. If I go into a restaurant and it's too busy, or a store and it's too busy, I have to assess the situation and determine whether I go in or whether I don't. And similarly, if I'm engaging in a social group that's greater than the current limitations, which are 10 for people indoors and 25 people outdoors, I need to assess that situation and decide to remove myself from it or not. If I don't, I have to recognize I am exposing myself and others to risk. We can't afford to become complacent. And it's at this point in time when we're all tired, when we've had enough, that complacency can easily slip in. I just want to finish just by switching horses a wee bit and talk about Ongoniada's strategic plan. Now, you may wonder, why do a strategic plan in the middle of a pandemic? Strategic plans are important tools for organizations. They determine the future for the organization and what it will look like. And to that end, we are embarking on a new strategic planning exercise. Our Vision 2020 strategic plan, which was undertaken under Wade's leadership, has now come to fruition. We've again retained the services of Rob Wood from 80/20 Info, who helped us with previous strategic plans. He'll be helping us again with this strategic plan. We will be looking for input from all staff, from our board, from our community, and from our partners. And there will be ongoing communication throughout the process to keep staff involved and to invite their participation and their involvement in the plan's development. These are challenging times, but we can't let, if you like, the challenging times that we're in overrule or dictate the agenda for the organization. We still need to be able to provide the services that we have been providing for many, many years and will continue to provide for many, many years to come, hence the reason for undertaking the strategic plan. By working together, by following guidelines and following the best advice and supporting our clients and each other, we'll get through this. It will take time, but we'll get through this. And we'll get through this because of your efforts and the efforts of your colleagues. And I just want to thank you and all that you do to support some of Kingston and area's most vulnerable residents. Thank you very much.